I'd now like to welcome someone who needs really no introduction. Tom Calma is the Chancellor of the University of Canberra. Tom served as the Aboriginal and Torres Strait Islander Social Justice Commissioner from 2004 to 2010 and as Race Discrimination Commissioner from 2004 until 2009 at the Australian Human Rights Commission. For over 40 years, Tom has championed the rights, responsibility and welfare of Aboriginal and Torres Strait Islander people, focusing on rural and remote Australia, health, education, justice reinvestment, research, reconciliation and economic development. Tom is currently the chair of Ninti 1, which builds opportunities for people in remote Australia through applied research, innovation and community development. But there are a couple of things you mightn't know about Tom. One is that he's the second Aboriginal and Torres Strait Islander to hold the position of Chancellor at an Australian university. And very importantly, it's the 6-month celebration of his 2 new titanium knees. Without further ado, here is Tom.
Well, what can I say? Thank you. And the knees are working, and I'd urge anybody that's considering to go and do it. It's well worth it, except for having to go through the airport, which is a real challenge, as always. Can I begin by also acknowledging that we're on the land of the Ngunnawal peoples and pay respects to elders past and present. I'm from Darwin. My mother's Kungarakan and my father's Iwija, and so I spent a lot of time up there before moving to Canberra. But also, I wanted to get at the very outset an apology that I have to leave immediately after speaking, or something I don't always encourage. But I'm convening graduations at University of Canberra this morning, so I've got to hit and run. So this is just a reminder of what we're talking about in remote Australia, and those little dots are all the communities, and I've worked in a lot of those, as mentioned, as chair of Ninti 1, which we manage the Cooperative Research Centre for Remote Economic Participation until recent years, and prior to that was the Desert Knowledge CRC. I manage on behalf of the government the National Tackling Indigenous Smoking Program, which is one of the big success stories in Indigenous health, where we have seen a reduction in smoking. Still a long way to go, but the rate that we're reducing at just over 2% a year is at a far better pace than it was for the general population, and do a fair bit of work around mental health, suicide prevention across remote Australia, and provide advice to government on that. I guess what I wanted to do today is not talk about a scientific approach to looking at health, but talking about some of the issues and challenges, and one of the potential solutions. I guess when we look at public policy development, one of the real challenges that we've got is that too often we're getting, and this is not just in health, but generally, fly-in visits from bureaucrats or researchers who will spend a couple of days in communities and come out as wise as they can be. And even worse than that is when people are just based in Canberra and make decisions on behalf of rural and remote Australia. And that's, again, for the whole population, not just Aboriginal and Torres Strait Islander people. But, and it's interesting because what we also experience is a real fair bit of kickback from the community saying that they're over-consulted. And that's one of the worst things, where you get consulted time in, time out, and you go nowhere. And it's not at least obvious to the community about what all the consultations are, and so the community gets very jaded and doesn't in fact participate in a real way. I guess one of the a couple of the things we hear, and we hear the Prime Minister talk about it as well, the mantra of do it with us and not for us, and the government are very keen on that, or do it with us, not to us, and also work with us and not for us, which is important from an Aboriginal and Torres Strait Islander perspective. And now, for this forum where we're looking at 20 years of rural and remote research, health research, I think it's really important to look at how far we've come and where we're going to. And so I'm going to focus on a group which we call Aboriginal Community Researchers, and it's about how we inform policy and practice in rural and remote health. Now, we mentioned Ninti One, which is Ninti One Limited is a not-for-profit company, but we have an Indigenous company called Ninti under it, and we do a lot of work in this area. I'm going to just touch on health today, giving a bit of a info about these researchers, but also just highlight some of the projects that we've worked on. I guess what Senator Mackenzie said, which was very important, is that as part of the Close the Gap, we've got to look at the determinants of health as well, and employment is one of those key determinants, as well as a range of other issues. And by employing these Aboriginal community researchers, we're able to really create a bit more employment within remote communities. And as this says, we've got over 250 Aboriginal community researchers working across 100 communities, and we've been doing this for a number of years. And these guys, men and women, have been trained in research methodologies and different approaches. But what's so important about it is that the research will be much more informed. Is the community-based people have a far better understanding about the history of the community, about the community itself, about the languages and about the cultures, which are really important aspects of looking at what we're doing. We work with a whole range of people, from the corporate sector to the industry sector, governments and community organisations in the work that we do. And I'll touch a bit more on that, but they're just highlighting some of the communities that we work in, the majority of communities we work in. We really are keen on looking at a shared space and a partnership between all the parties that are involved, be it government, who are one of our big clients, but also the research sector and the community sector. And we recognise that in doing that, if we do work it as a partnership, there is a whole lot of shared space which we can work on. And our communities, our community-based people are the people that can collect that data and provide it. And the key thing is that it's the relationship that they have within the community that's already there, that doesn't need to be developed if you're an external person coming into the community, and or what we hear so much for, and why there's a lot of inefficiency in research projects, is that people will rock up to a community, but the people that they thought they were going to see aren't there, and so they're not able to to work it. And just as an aside, not through Ninti, but another organisation that I chair and patron, the Poach Indigenous Health Network, and the work that we do in New South Wales for the New South Wales Government in dental health services shows that we're able to, because of our relationships with the community, we're able to be twice as efficient, and we can do services for a quarter of the price that government can do it, because we know when people are about, we have the arrangements, and so when a dentist flies in, a government dentist flies in, there'll be somebody there to meet him, and not him or her, and it's not a wasted trip. So it's those type of efficiencies that I think we can get out of what we're doing. It's all about participatory research, our focus, and it's about actions that must be done with people and not for or not on people, and that's critically important for us as Aboriginal and Torres Strait Islander people. And I emphasise Aboriginal and Torres Strait Islander people because it is a very, very big sector, and it's a very big cash cow for many organisations who are wanting to do work out there, and it's important. And I shouldn't say cash cow in a negative way, but it is a good way, a source of income for researchers as and when you get it. But we, through our research, we look at project management, community development, participatory research, as I mentioned, and particularly evaluation services, and work with ongoing evaluations of projects as we get there. And we also work with the researcher on planning and design of the research project. This is where we're engaged. We manage the logistics and all the on-ground, and particularly the logistics of getting people together for when the researchers arrive. But we do a lot of the preliminary research on behalf of, and we conduct much of the research, as I said, but we also analyse the reporting. And I think what's also important is that we provide feedback to the community at the end of the projects. This is just about working with the researchers, and our senior research officers, they co-design the research programs with the researchers, people like the CIs and so forth, and not only within the universities, but the project could be with the corporate sector wanting to do something within a community, or the government wanting to look at a service within the community. And recognising that governments also have people out there, but they're often not from the community. They're again external and don't have the level of reach or confidence of the community to be able to provide specific issues. But I guess our services, I mentioned, the governance, the social and economic analysis, but also health and well-being is a very significant focus, and a big focus on youth and disability. So, and then we go into a whole lot of other economic activities that our researchers can do. I guess one of the key things I mentioned was language. And as we know, many people in rural and remote Aboriginal people don't speak English as a first language, or have difficulty working in English, and so having somebody who can interpret and translate and conduct business in language is most important. But what's also important to recognise is that these guys, the Aboriginal community researchers, have been trained that all the survey and data collection is done on iPads. And so at the end of the day, after the work's done, they can produce reports and deliver them back as data packages back into whoever they're engaged with. And as I mentioned earlier, for us, for our point of view, and where it's agreed with the person engaging us, we do provide feedback to the community, which is closing that loop and trying to get away from the whole issue of people being researched and over-consulted and never knowing what happens to it. And so we go back and we work through on why we've done the research, what's expected to be done with it, and work with the community to be able to do that. I guess, again, it's totally different formats that we use, but one of the key things for us is that many of the researchers have come through and they've gained full-time employment, or they're in part-time employment, and they're part-time because it's only when we get contracts that we're able to engage them. But even those that have gone on to full-time employment do come back and want to, because they love doing the research. And for those involved in the university sector, we are also members. Our community researchers are members of NARICAN, the Australian Indigenous Researchers Network, and so Knowledge and Researchers Network. So they are recognised within the sector as being skilled and qualified to be able to undertake this research. But be able to employ people creates that bit of additional income to a family, which helps to alleviate or at least move away from the poverty cycle in one way or another. And, there are multiple facets. We sit on the ground, we can sit in an office, we go to where the research needs to be done, and that's critically important. And we do it in a way that the community is most familiar and comfortable with. So I just wanted to look at a couple of studies, and, the first one, and I know you've had some, you had Professor Taylor give you a talk yesterday about his trachoma project, and we recognise that, but Professor Taylor engaged us in late 2015-16 to undertake a whole lot of work in 6 communities around Alice Springs to identify how impactful his program is, and what are the learnings from the community and how they go. And I won't go into the detail of that because you've already done it, but it was interesting that goanna up there, called milpa, is really the showcase of what his program's about. And through our research, we were able to identify that 77% of the people had seen milpa, 75% knew that milpa meant good hygiene, good face health and eye health. That 73% of people see milpa and think about eyes and faces, which is important, and also 86% understand what MILP is saying. So when we look at impact, it becomes very important to understand what the community knows and of our products to see whether they need to be tweaked or whatever to go ahead. But that is a successful program, and you can talk to Hugh if you want to find out more about that one. More recently, we worked with the University of Canberra and researched 54 communities across the territory. One of the things that's incidental to this was that I found out that that in quite a number of communities, kids as young as 5 were smoking, picking up cigarette butts and having a little puff on it because people were just not considerate, and it's a real impact of role modelling and what we work on in our program. But this enriched program, Environments and Remote Indigenous Cardiometabolic Health project, was an important one. We looked at the 54 communities which we surveyed using UC's Health Community Assessment tool to help guide the discussions, and from that we were able to find out precisely what people knew about heart health and some of the environmental issues that are impacting on heart health. And I know that you're going to get a presentation a bit about that in WA. How much is that? 5 minutes? Oh, good. Only got 20 slides to go. No. No, not really. Only got a few more to go. But knowing which aspects of the community environment influence heart health is important, for the community to understand. And so it's not only collecting data, but it's that loop that we keep on going, I keep on referring back to, is feeding back to the community. And so a lot of our Aboriginal community research has also become what we call Indigenous community change agents because of that additional role that they do in working. So, even though we've still got a long way to go, it's, we are seeing some results. The Brian Holden Vision Institute and CRC Vision project that we did, which was also fairly good. We completed that in 2016. It was a 2-year project, and it was really looking at developing and delivering the world's first intelligent retina camera, and it was basically about early detection through retina imaging to try and identify onset of disease. And this project was pretty exciting because it was not only the Australian partners, but we had American partners and also Chinese partners, and something like about 11 million scans had been done in China that we were able to reference, and from that identify disease. So that's still got a bit to go to see whether it gets into broader application. But our role there was to work with the community, not in conducting the scans, but the community's understanding about it, and try and break down some of the fear factor about what was happening, because that's one of the sad things for a lot of Aboriginal people, and why our health outcomes are not the best is because we're a bit fearful about finding out about what we might be experiencing, and so it's late presentation, which is always a real issue on that. So that was an important project on there. The population and labour mobility research, which we did, over 2,000 surveys done in the Alice Springs region, really looking at why people are coming to town or why not coming to town, whether they could make it or not, and so we conducted those to find out where people go, why they go, how they go, and what problems they encountered. And from a health perspective, it becomes very important, and we know about the purple bus and the purple house in Alice Springs, and all the dialysis equipment and people not wanting to move into town. But it is, the reality is that there is a lot of movement, and that becomes very inefficient or very expensive for Aboriginal people. So we were able to influence things like transport systems, service provision, the planning for shopping, sports and other cultural events. And it became important, and this is the associated aspect to it, is how the basic card had an influence on people's capacity to do some of these activities, and be able to provide advice back to government of the value of cultural and other social interactions which lead to better mental health outcomes and wellbeing outcomes. I mentioned the Tackling Indigenous Smoking program. Ninti 1 hosts the National Best Practice Unit, which is the only one of its kind across the nation where a third party, a non-government party, helps to deliver programs on behalf of government, but also working with these 37 grant recipients to have a better understanding about evaluation, about service delivery, so we get some standardisation without wanting to clone everything, but particularly on the reporting, making sure that people understand their obligations. But we work with the Punapima Health Service in the Cape York to train up their trainers. This is the Ninti community researchers, to train their staff about tackling Indigenous smoking activity, and we're also working across which we call a cascade. So we train them and they go on and train and deliver their services, and we're doing that across a number of other communities in the Cape York. And it just shows, I wanted to show the diversity of activities that our staff can do, and we do it on behalf and in conjunction with whoever's purchasing the service, so that it becomes a really important activity. This is just looking at some of the other activities that we do on those communities that might be interesting. But I just wanted to finish by saying that it's, I'd really encourage researchers, be you community-based or in universities, in the cities, to think about what you want to get out of your research and how it's the best way, the most efficient and effective way of getting that. We argue that you do that by engaging somebody from within the community, somebody who's trained in research methodology, somebody who understands about ethics, as they've been trained in that, and how to collect data and then report on that data back to you as the prime researchers, and they do it in a way that you want it done. So they're your arms and legs within the community, but also to remember the very big importance of making sure that we have a feedback loop into the community as to why we do it. So I leave you with this, just our contact details. Thank you for this short time. Apologies that I've got to go. You'll be told a bit later about one of our graduates, key graduates, who's with you in the audience today, and which we're very proud of. So thank you.